Delal mal orang malu dikla nama gidel tial be es to im la du parba blue belau mengani artok tang mem sao terni mengani ara hospital eleng dia ngarang ngoya abela agora mle ngoya black breakthrough ora asidigi tiagi de tel la gas enga que se la cotel mom de liar que Santy e ruata la ospera ta central la gana di tiagi de lo tiamo que tratar lo que da del belau como que mom sa dri de alto ta mo tialo lo sa Santy mo introduce a mam ngastia rogui o mo ra programa li
mansulang chairman un total mara rogula del book no se ve del el magre el alto tau e kadang tangat el dinar bluat el ngari aquí del digiser la bluadra Ongael claro ngar al sel madalom ya tari aquí del lom le lo igal blal tu chairman a te aquí del Delal agar malo betul asen Ongael kadang tangat el direct di wadul spe ti claro e un daso sei ga kora di tora irar balu ngora di itora aklebela orgi de ngukti gi do spe e dimna do ngelo ase ya ngaria rum a ikla barda el masuba igal toil lo meslo ase gang maral ngaria autotelela ma abulgul ma klisi era tora rolela garra agel lo suba sains kadama ngal tanga Delal tutau el ngaria taramal limos kala del matatal direct el msuba atiagi del toragar el salid el la omais el mera belaul mate namo telarrak esera tel nombre garraga aquí direct el yulme ngaria introduce a Dr. Graz el direct lo bangere del tutau el direct el kamata unsube atiagi del Ongael a direct del tangatel ngaria taral ngal belau el Nora School el día del Nora School el ngidi lo sub lo asendim suba loms direct el Nora School el no ngwa Ph.D ngi el tiagi de Ongael mendirect el soda a Dr. Chris Kitalong el direct el telo bengedel el mom skida el nia ko o tiagi de lom subera a tora science el lo asen dia telo Ongael a dia al tora di Quaradim langtang aringi malut kora quaradim logo aldo alit tiang maral mlamo soi sebra sela scientific community mlamo ngaria ungilom subel ngal alsel ediragal gadal tangaria a chairman aset other hospital kirel waise madelo asende al salsoria do aset other hospital le tirgang tirgel bebi la tangala hospital raidar ngari ingel triple gate ingel do ngali dia other belaul el mlamor hospital di mla tal le sanga gi del gotel mle bs tongak le makasanga ma ayu le bele leul el ngal gang esal mle nursa Seba kle e direk ngaria ta ngel belaul direk mla school me el la sublera rolela public health ma atora rolela hotel aurior angaria pearl el direct lo benget e direct ngaya taramle ngara auror hospital lo rurta yegi del grant mle ulan direct ngaria wil el gora tora rel omsu bra health ma tora augru el mergi da agar belau. So basically Dr. Graz, I have introduced all of you here. And what is it that we are here to talk about? And we're here to talk about Ongael. And it's good thing that this is like a follow-up of what we were here last year to speak on. So maybe it's best that I turn the microphone to you and that you give us an update of what you have been doing since the last time you were here.
Okay. Perhaps just for the sake of modesty and humility, I need to put it a little bit in the context.
Okay.
Is that okay?
Oh, very fine, fine.
So first of all, thank you for the invitation. It's a great pleasure to work with Palawan colleagues here, coming from so far away. It's incredible that today we can work like people from the opposite part of the world to be working today on the same problem. And what's interesting is that actually the problem is the same in many places in the world. It's obesity and diabetes and high blood sugar. And so I want just to put it a little bit in context.
Okay.
Because all what we do in terms of drugs, treatments, including traditional medicine like Ongael and also behavior, health education, all this is only a tiny part.
Can I have our chairman sort of summarize that for us?
Algo Dr. Graz saying, "Jakse bedo kwa di idire kesoi sebra setialom su, itu sodin mongi. Ingire tu kwa makata kliru era kotis sebra se tiang ngarang, ngarang kadam rule. Mengenai setia sing namo mer taragara almer bela ngai kita ngar bela ulorior el hospital gitu o si time en beral tialom su bul gidel tiagi ter Delal gal longai. Mendiak di miltang ani ada biara dilak ngalmut mo saudan mo ko magai en ngalmut mo tugibul. Kaya su mangani ako kilo iterun masen from diregan.
Dr. Graz, can you pick on the behavior? I think that's a key.
Okay, so I can explain now why treatments and behavior and all these individual measures are only a tiny part of the response to the problem. Is because it's a law in public health that has been known since a long time that if you want to tackle a problem, you need to look at the structure. That is the way our lives are organized, the way the cities are organized, the way the workplace is organized, the way our transports are organized. And that's where the key solutions are, actually.
Can I
Dr. Graz amlogola se selbo do su batretele la rule el girela raptor warwa sugal makuldelbu mahaiblad magerogui endiadil como klada gidel me emergo mo smoothie la se kedem grang ada ador roba igal mukit raktan la asois brauluat tele la klada gida atar bela uma atletele omngale ma atletele la toy dorul ai gida ro kuya bodok tak emergo gida mo se edel mokmedra terbengela ai gida mukit raktan la asois bela
ndiregal di talistain ndiregal mo la sa gel tele la dom over tel bloat la role la togor olidiu lama agel togor al sel aurior dangal al sel magarado ado ngotmok la gel urere dal gira dangal al sel ra agel urere dra argabli da magel urior dorura sel da bora aure agel guguriol da bodo urior ngira bekkelsi.
Yeah, if you want to see examples of what I say, you can compare two industrialized, two well-developed places in the world. One side is North America, and the other side would be East Asia. So on one side, in North America, you have huge obesity, NCD, high blood pressure, diabetes epidemics. And on the other side, if you look at East Asia, you don't have it. And this is despite the fact that in North America they had a lot of behavioral program and a lot of treatment and so on. But the difference is not there. The difference is in the way the environment, the work environment, the city environment, the life is organized. That's the explanation why it's so different.
Sildo mesa agil raktel do saudela ekdoya kadum saudenia sia oya mrigel ikun war Ako rakmal buto ang Ulkerreuil mga player matetela la klata team hindi direct dia Israel lo gora am grur tiar treta mal klunga. Mbai gai gidel blue rarwa bela marwa a blue ra Asia. Ai gai gida len klata gidel dia adul tuira are ma agora tokol tretela la klata moru lid mo mo ka ser era ai gai gidel kitrak.
So all this to just, we need to remember that when we take care of treatments or behavior, we are just much too far down the stream. But to really solve the problem, it will be necessary to come to the cause, which are, as I said, in the way the whole thing is organized. Just to say.
No sem dia adil biota tetela igalu grul do sauda. Sumun saudal mo sau ultia rapta. Ekda mora igel go tulu uringi. E o van men arsel. Emer go mo subedem grur, mo subel mo ngir la tetela klata pigit. Mo dia adil biota lurior tia tangar.
Ala dikta lisen mulgolo asia selgora ya itna ba adram rigel asoril waldilo makarat tial elngia agelngia arak seguid el togal olgoringil asia sia dortoiringil bay merin bay sel do portial asia kadmor sel ul asia adam wangara tretelela akla ada tir maklang artir agelongot mokra be krisil sia sabedel la amado ringi gut makli sigida gora mo utabngi gari yes.
Okay, I think that was just to put the story in the context.
Yeah, okay. Seguide chairman alolgornia Dr. Graz lo hace. Atogol sal lo saudril do saudril metel togora Ongael. Agire del saudril ngar alchera hoy seguide luldaso. Lo hacen ngara blue di saudlor toir lo hace que dio lava agalom garsel nia seldub arakta egado mortoy lo siga agalom garngi malu egado pura sel selta awes lo ase kadam garanga al sel ablu sum okla aklangar gid maigel togoro agel environmental gangar al sel omngar ablima omngar al sel agel ulol ga ulol ringi e but moklemang sver el bay mga lo mre ergaur segidel omngar ngi araktema asbedel mga uturingi lo batte aquí del tora omso de la auror onga seguida wal blal gora aldura sin suada el mukut maklil mo uldaso el domdas rim sa batte aquí del tora onga yes so is that
about Ongael now?
Yes.
So perhaps Chris could explain how it all started, because you were there at the beginning of the story, or at least.
Yeah, when I heard about Ongael, everybody in Palau was talking about you.
So,
yeah.
I think that maybe Bena was probably the first guy to actually look or export Ongael as a source for research. Am I correct or not?
Yes, I was using it as I was going to export it, but I needed to plant more. That was the whole idea.
And there was another group in Japan that did some work, Matsuda. And I think actually Bena was working and brought someone else to them to do some research. So there's a huge story that goes around, and it's something that goes even further back to my dissertation, which looks at the ecology, or where Ongael was. And we found the island, in the rock island named Ongael. And when we looked at that island, it had the highest density of Ongael. And then when we looked at all the places on the rock islands where people live, those are the only places where we found Ongael. So the story of Ongael begins with the first people that came here. It's not a food. It's not good firewood. It's not very beautiful. So why is it here? And the bats don't eat it. The birds don't eat it. So the only explanation we can find is that it was brought by people here. The first people who came because they thought it was important. But obviously not for food, firewood, or for decoration. So it must have been a medicine from the beginning. So that's the beginning of the story, I think.
So, Chris, what made you think that this is something that you should pursue? In terms of higher learning and.
I was, of course, our generation is raised in a Western society where the question I asked my dad is, how come you didn't speak more Palau? He looks at me and goes, I was trying to learn English. So this is the society we were driven through. So when I was in high school at Xavier, I worked in the summers with Dr. Yano. And I said, this is something I want to go into health because it's something that matters. It's a good industry. It helps people. And it's profitable. And economy is something that everybody looks at. It seemed like the only thing people looked at is Palau. So I worked around the clinic. I did work on doing screens in the lab, and then I worked in the pharmacy last, and I looked at them, and these are very small things, and they cost so much. So I kept looking through that, and looked at that as something that could be a possible economy for Palau. Some small chemical that requires a lot of smart people. That's what I wanted Palau. Because we're small, and we hope to have a lot of smart people. This is the way I moved forward with that. And I asked Dr. Yano, maybe I should become a doctor. And he goes, what do you want? And Dr. Yano says, and I told Dr. Yano, I want a university and a research center in Palau. It's my goal in life. And Dr. Yano said, okay, you cannot be a doctor. And of course everybody said, why not? Because you have a huge patient load. So Dr. Yano is busy from morning to night, and even when he's sleeping, people contact him. So we couldn't pursue the research that he wanted to do. And if you look at the Palau Medical Clinic, it has the typical, as you can see on the shirt there, there's a tree.
Yeah.
There's a tree taking the place of the famous medical physician. What is this insignia from Greek mythology? Dr. Graz, can you explain? The normal signature without the tree. The two snakes.
Oh, that was the symbol of pharmacy and of the god of medicine, Asclepion.
So what Dr. Yano did was he took that and he put them around the tree. And that tree is Ongael, Delal. So this began way before me. So that would be going back to the beginning.
It's quite interesting because we're glad that you were interested in chemical, and unfortunately it's not the chemical that's on the streets of Palau. And that we're so fortunate that a young, inquiring mind and aspiring mind that you had as a little boy saw this, that it's something good for Palau. Now, can you tell us if Ongael is a real thing? It's not some sort of a home remedy or a folklore, if you may, that sort of just all talk and no science to Ongael.
So I guess you'd have to go with the rest of the story. After high school, I
Yes.
went to college, and I pursued. Actually, I started as an engineer, but then I pursued medicine and business as sort of a double major, and then I ended up going to Japan, to a place called Toyama. Toyama is very well known in Japan for traditional medicine. It's the heart of traditional medicine and the entry of Wakang and Kampo Yaku, which is the traditional medicine. And I went there for a reason. because in the pharmacies in Japan, they don't just have Western-style chemical medicine. They also have traditional medicine. And each medical doctor has to go through a year of training or schooling in traditional medicine as well. So the lab I went to was a famous professor, Hattori Sensei, who was known for studying mostly Chinese and other Egyptian medicine. And I said, I think I want to look at a society that was able to use sort of an integrative approach. And I know India has it as well with Ayurveda, but we had it. And as I did more research into it, you find that almost 65% of drugs that are used today, as they call them drugs in the hospital that are prescribed, were derived from plants.
Mm.
So I said, why don't we make our own? And I talked with my grandma, because every time I get like diarrhea or mavina, she would give me guava leaf. Or when I had a big bruise or had a fever, she got another plant. So I knew that these things work. And we all know that they work, because everybody's tried it, no matter how hard you want to deny it. We're not past the generation where nobody used it. But the point is trying to show people that our medicine works, and that from our medicine we can derive things that maybe work better for us than other people's medicine. So that was the basis of my dissertation. I took 26 plants based on a study by Okabe. It was, and of course, because when you go to Japan, you have to show them that you looked at a Japanese work. And then they really let you in and they give you anything you want. So first I already knew them, and then I verified my grandma, my father, and other people, and then I used Okabe as the basis. And I selected 26 plants that were used for medicine. But when I went there, we had to always select one, the best possible one to study, because it's very difficult in the scientific world, and it costs millions and millions to develop even one medicine. Can I go to billions or just millions?
I think now the figures they usually state is like $1 billion. Yeah.
So I knew that we had to focus on one. And when you look at the name in and of itself, Delal, I thought, this is the one.
So it's a very interesting story on how something as a little boy and you start building up to this point. Now, and it's very interesting that how you find a way to penetrate into the Japanese scientific, community. So what I also want to know is, so this Ongael, would it receive the same respect among scientists especially pharmacists, because there has been a formal process that has identified the properties that are in the Ongael, or is it still speculated and guesswork?
I mean, I think Dr. Graz would agree, and most physicians would agree, that most drugs that are even on the market today are still speculative. And when you read on the labels, I know because I would read the labels in Yano's pharmacy, and it would say, but exact mechanism not known.
Oh.
On most of the bottles you see, it shows improvement in this, but exact mechanism not known. So this was kind of my segue. So the work in Japan was looking at different models to look at mechanisms. But that led to us understanding important principles and on why. The question you mainly ask in science is why. So the most important thing was the end result, which Dr. Graz took us to look at, is, does it really work? So the question I more had was why, but I think the scope of it and the real end goal was to see, does it work, or can we show to people in a way that they will respect, as you said, that this thing really works. And I've had this idea since the beginning, but how to do it was very difficult, because I know it's a lot of money. And I guess the real driving force, or what took us to the next step, a huge jump forward, was the introduction of Dr. Graz to me by my advisor, Dr. Bena, because he has done this in other countries, where he looked at simple remedies and created huge effects, which is what we're trying to do here in Palau, is to show people that what you have here is just as good, if not better.
Wow. So I think we can say for sure that the Ongael has walked the walk, just like any other drugs that have been accepted in the scientific screening, so to speak, in the process in Japan that you say would cost millions, if not billions, of money to do on any studies on any possible medicine. So now let's sort of go into the area of now we know through the process of not only from your grandmother and your father and all the rest of your relatives in Palau. So what can they say that is the effect, the therapeutic effect of Ongael?
Perhaps before going to that, I should explain the story of how do we come to study Ongael and not as a priority and not many others.
Okay.
Because that's a huge problem. When you start to look at traditional medicine, you find that even for the same disease, if you go around many houses, people will use very different things.
Oh, okay.
So how will you focus on one, and because you think it's the best one? So that's
okay, that's
a nice research question.
Sige chairman luaseng milsadriya Chris luaseng betoga yal grudar other belau. Engai da Dr. Graz luaseng tedimlo terkle Ongael el nyawa bolo su bngilen to segada magarang ngwa sel imol gas el nya me ngania a chlorelle betoga logrul mora gida other belau. So yes, that's very good point.
Okay. So actually, that's the reason why I met Chris at a conference in New York, is because the doctoral students and master students, they're always sent here and there, and they travel a lot. So we had in Switzerland, from Mali in West Africa, who then invited me to look at their traditional medicine for malaria. You don't have malaria here, or you have it sometimes?
No.
You don't.
Yeah.
Yeah, but they have a lot of them in Philippines, Indonesia,
Yes.
Papua New Guinea.
Yeah.
And in Africa, it's a deadly disease. It's the main cause of death. So they wanted to know if some local traditional medicine would be good for that. And because sometimes they don't have access to the modern drug, or they don't want it. They want to use their own traditional medicine. So we went around the 2 districts doing a population survey. So some students, local students, like college students, during their holiday they would go out in their home village and ask houses around. And they found that in just 2 small districts, there were 160 different recipes with 60 plants.
Wow.
Just for malaria. And also, they found that only one was always followed by cure. The other one, sometimes the patient gets better, sometimes not. So that's how we decided to focus on this one.
Oh, okay.
And we did all kinds of studies on these plants, which was actually originating from Mexico. Plants travel a lot. And in the last survey, it was 100% cure. So I had to present this in New York, and that's where I met Chris, who said, oh, why not try the same type of population survey to select a plant when there are many used for the same problem.
I see. So that's the process of reducing which plant you're going to study. So that's now I want to. So this is the process, and now can we look at what are the results of Ongael study?
So the first results were from this population survey in Palau, where we found that the people using any mixture of plants but with Ongael had better results in terms of blood sugar. And this is why we thought, oh, that's the very interesting plant to focus on. And then we did two things. One thing is a clinical study with just a few patients, which were not patients but volunteers among ourselves. So Chris, I think, also can explain what we did there much better than I do.
Chairman Kamlutur di Sekida Lastal Dilia, Dr. Graz, Mulu Asim Magara. Malgortial, Delal, Masetelonga la ultim langiltia, Masetrilla Survera, Sela Blur Belau, and the Tangal Adrombra, Tel Talalagar, Malunga, Lima Bebira. And the Tumlotir, Sela Gel Survel, Gilmokra, Blur Belau, Setriel Adel, Tony Tegel, Spet Telonga, and Malun Dalalagar, Ablol Tigatil, Lungira. Atial tora se era sugan. Dia sal potokotira ruepter seguida. Rastra sugal mata uletel lo ase hale dru tel mosubise. Seguida twis game dru tel muskao seguida. Lo asen tial dala lagar ngaram ila rela tamili maniar adra belau tadi dilu lo asen ngungil gas. Betadi di min tu ase dala lagar. And the Gamelu thermal smoothie was saying, what is it? What is it? What is it curing? Or what is it helping for anyone who's taking it?
The Ongael, like I think Bena knows the names of things kind of change based on the use. Like Kalela arm. I think there's a different name for Kalela arm. So things change based on the use, and what Dr. Graz was trying to mention is that how do you select something from a huge batch? And you ask about how it's used. So the first part of our research is asking people what they use things for. We went around with people from Oigul, Ibobang, and all around, and it seemed that Ongael was used in many different things, and the uses were mainly for metabolic stimulants. So that was the first clue. And the next clue is obviously people were still using it. So the question we had was, does it really work? Why don't we just ask people if it works? Because there's so many scientists around the world that come here and they don't ask anyone and they just go try to decide for themselves.
Yes.
When the best information is sitting right next to them. So the question is, we asked students, high school students, and we have to thank Larry and people at Upward Bound because they got these students together and taught them the value of the people around them. The question was, are you taking any traditional medicine? To 5 different people in their family. And the survey went all around Palau because many kids are from everywhere, so we said diverse. And it was a very good spread, except for we missed 1 or 2 states.
Yes.
But that's okay.
But we even had someone from Sonsorol.
Okay. But it's okay, they don't really skin. But they found that people were already using it. Because people knew it was good, and then we asked them, you use it, but how does it help you?
Yeah.
And people were using Ongael and Ongael. Those were the 2 biggest ones. And Ongael, of course, we all know it's very popular because of marketing.
Yeah.
And then we asked what really helped, and we found that only Ongael really helped to reduce sugar. Ongael was more for maybe weight loss, so that might be a subconscious thing where they're focusing on their health. But Ongael really worked for people. from a blood sugar level, from everything. So we said, okay, let's move on to see if it really works. And then, so the design was there. We're the sort of architects from the beginning. And then the action came with the people who've done most action in health, Seba and Sai. So maybe they can explain the process and maybe some of the difficulties, but also some of what they felt people wanted when they saw them, some of the issues.
Lolgo Chris lo hacen Tialong la hablar tigri ayel lom ben es el ni hablar ngari siabal ma Dr. Graz e dire que lo giwa survey la montig lo hacen tia ambay ngari chlorelil mora tokolada la tokora rolela badingir maraktis e hacer mal blagtak blal batigri se sel sugal ada angul merio. In fact, because a doctor Kitalong Agilsang 2 or 3 years ago, elama 3 years el gular Ongael, el gu limra de la lagar. Y ahora el dilli a doctor Kitalong hacia como el montiger gaul, telgib el goram sisi abadingim. Ga goram mal bagade ding mes el bui masing gorawala ngariya energy booster gaul. Kamu mentiger kalau asega kora wala masisi abadingem mal marang Tkedesau le sera bokotel los pega longael akmal au akmal bolol gora dimo msau elang mal dingarinya energy ngagal throughout the day seguida maral el black patiger ni ngagal elang mal dia ku lima Anyi dil gora energy drink el ngarastuan. Sel tegit el Ongael la tia gulimring. Kami uktungul masanga tegit el ukterul tira ngara tulur hospital era tangara community. Mugukto gera udo silo asengara ombreng sera adra blul magami aku o senior tia toera gar Ongael.
Seba no mamo.
Oh.
Muito tal. Era todo mes sello msubel kiblet tel radio oling science for tel UAK recruiter sugal smell al Delal en baito al gorira gel mortiga te stofta como manganira era gibo mosao da gel soltera ngania ake migal asel tel garqat Existe como smoli seguiden in clear telge migal letiang aklal wala pharmaceutical thing mga duli ma ada bela mong vanilo sa jakal di tel garagara ngari telge migal alsel el busklia abnya la ad mong makaskelanga asuwaling seguida ngar toktang seloil mergmam e agi smoli tel pakardel la ad telom subel gi multitri gal ada bela angara 60 sama الآن الليفل بوي لما كيمورا مسؤولي لو دكتوريا نو كده سبعة يعني سلو مسوبة أو مسوبة رأدر بلا وليد في أشتوكتان أو بس كلالو كلالو ميكال نو كريس بليز magniferent أكيد من سموديل بس مغرام را هذا اسمه سوبة سيجي دكتور بغني على test.
There's many different chemicals in a plant, but this one was a very high content, and it was very focused on water extraction. So the focus was looking at what's the difference between the whole plant and the extraction by traditional way, which is boiling it in water. So I did a comparison between a lab extract, which is like using alcohol, because alcohol takes more out of the plant than water. And what we found was the focus of that extraction was a higher percentage of one compound, mangifrin. And this mangifrin is well studied. Even with your group, Matsuda, they found a high quantity of this, and they used it to test on some diabetic rats and macrophage activity and a couple other things. And then this compound is probably one of the most highest quantity per gram weight in any plant in the world, although it's found in many plants around the world. So from there.
Dr. Kitalong, can you say the name again? I'm sorry, it's
Mangiferin.
Mangiferin.
Like mango, mangiferin. Because the plant, that compound was first found in Mangifera indica, which is mango.
So that's the chemical.
That's the chemical. That's possibly.
Yeah.
But as we get into further research, the only way you can know for sure is by testing that chemical versus Ongael by itself.
Okay.
To see if there's a difference. Because there's many other chemicals in there.
Yes.
Most likely those ones are the precursors, or the ones that in the plant it starts from a small thing and goes all the way to a big thing.
Okay.
And there's other things in the line too.
So msayide per lo asen kertuk lo asen tiagi del mangiferin ngara sila tial dalalagar tiagi ablal kiti tia science ngai na melgo asen dire gal ngania dire gal pedinga la dire gal ngod el chemical sona sel tial dalalagar ndi sel oral mel me seguid el mangiferin clorclalwa sebe de lo besin la seguida la dos melang ingrado ko ger milo ser obom mo su bertigel tira sugal ngara gom guk miles
elat talo musuba amngaira segagi de scientist doctor gi e obangela doctor yano doctor me
quai si
e obangela Seba nurse me denga abi overall bacteria other barut me
I see
what workers me magi mlota ka aigel su engi enletia yo lingi tara boy still no spare other mom super still metiginingi still what the flora rolel super ga gida ro spare other ngani lo udara no tirak the musel full gangi se flor gangi still se bombonge magi mo gitia klanga ga metiginingi magi mlo mai hastegi del IRB ko to tutela bolo ngel aga se igalo subra a Klengar aga ngarian lo ul maki man no tira kleu sel gange ra habelment e ul mu sel lurio este lurio ra a tablol to wa mi amlar alse actually kalve del gotel lo parte ra lurio ra telo musuba ul mes se sel do lo especial no super ya crystal del nombre del Ongael estela galel estela badel estela siga badano seni estela clendalela se amel batmo mangarin nombe mo ser consistent tial lilo mala osto dani e onge ruma amalaya sira a tial lomsug en mora label di imol lab ngani imol mesin min da variation ra atoira measurement ra min DOCC standardized ra onge ve a mogititi aklanga sen mesra klaadani ra besil mai gero hul tla sai la klanga ringi lo sen magaranga ngal ade mga smoke ra te le del buil magarin agim lom tigringi lo hace aga tilu estelom su estiga screen de kal smoke sugal kal screen de sugal dagi mola ada kal sugal ma ngani egel ko serial dire ma smoke la en metua magim lom tig te sugal rogui magim le Michael baseline stir la ma interview stir ito malmon raklanga stir ito mo emerson balngel la usub egi ku muta mala measurement stir malala stir mutegiti bisel la mesel balngel usub ngari aki mo ngono ni se crossover bitamali matablol lilo mala imo nga ongael imo nga dia kalongael hindi mo sisi wasalam semul ma akalo ringi ma akora bul gua mo smedan smal mo ay trigel other omsu gimusu bertir tigal participants ada algo sengara tamlina ege daruli tel lomsuber mo mabingil wasin sel to na gal labertis etong milgasak mang dire ka sel behavior sel lomsuber sel labertis adire ka nangin gil tol telang tingil mo affect sel result la a behavior beto tia bi sel beto ka result ay gimlo mabingil wasin sel medio wasungel siya man le clone lolo hotela tirgel millimer ongael material millimer ongael tirgel millimer ongael material limla lo limer ongael per ang sa emel pula se limla lo limer ongael sukal tira dimla sisiu tirgel millimer ongael am lo rio sukal ti tirgel meri ngani sel lifestyle behavior modification ngayon lulukong kaki deruba kan Dr. Graz ngundi mo kra environment social behavior ka apektasin sila wata ka rokoy NCL good mo clear management na disease good mo clear sila ngani sugal men ngani ada lulung marang sel placebo tura obisin ngayo sugal ni ta happy marang di ngani gigil luguk tinagim mal measure igel attributes ra a behavior litia ul mesra walel lomsuv egim lo bestigel wasin mal betoqa talang tingila a behavior ma tialgar ma other kerbelau lo mesra siwang argaw ma talang aslem maskular ngalikem ma ay gigita may se kam sa kupta se ate ala se ba mo kwa mutul gilungi se gida la tora other belau le ay result niya mal ko ka te gorga Seba Meral betul ke kena start musuh ni wal ke kalian ni mo kete Rosi ketian longan masih ngobrol rasukan. Isela kim si sebeli enggak arung al melo la ba betul tal allen. Jangan sebab mendimu isekim bobong ma emosi gratokta. Maki telgi bernos mese atau malulungi lulung sewa melangi aku rawal gift termotikan roku nemsu klukomir. Maki mlol si sa akartir la role la lomul balore arole la lo o oi dahlir base asuk kamla ko ya klo lonrao leng mo mga yasay emu asuk ko leng me mesal masengara mo ngod argi. Msege dina kan man lo ulet mal blakar di lesen lo ga gel ko la lom da tuk base ay kaungil el wasu ko leng mil sal ngil ngayo yang mari letrin mo blakar di Mestia lo ngai mestia lo msu. Dide kal lagi belum besar dah betul tele la exercise ma odi kala tablo lo sik masengara ku ngin merga masuk ki ho madangil la malu ki ho yu mukala ki mo odi kala meng dimla kala beot to ko lagi mi expect ra di imo emlong mahmal mo betul lo nyarwa dura de la mangaria sensible la selo le taklar medio ego kumal bongas ego kuwe medio si supro prio bom dia nga ege be bila o woti kala sela blai mang betok adam lo mere ke tia dir ke sori le temixal mula setiap halo beor mata mlania sel meeting el blogging rally motiger roku ilu ke gar sia bo akin kas masum etak mo memla kas masum egim lu tel malamol ma mela tamlo malamol lo bangela na kuma no bre ko su tira mil lamol lo malaka dire mo mesra tokta may gagi daw ko sa amremo mela ko practice science sa VL ang mlabas ka ba malmum tul beto teletal gire rol le ad ospel ni edia ki mesa masay aki ondur tutrin morkir e kama makoradim le mama ko dim lagi rohosi edia ka ko la official ka mam hibor ni aki mok laigang tiada hal kekeren to ko giblam ko am ki sia sim berrabat to ko kire rol le ko dia ka mo ver puting mai ngani o gada Gugese ngani kandel maklol swavel gimi like beto ding aktimo umbe agim lom den se trigagi del other belau ma one other bar ma other holy feeling maklol belau am la setalo number 1 is keep tigani after other belau ma stress agim me sure agigi del rogut talang tangi laklanga betul question ke ngara tak magarengel wonder keep tigani after other belau ma stress na management stress la dalong os ma urior ma al-abway seguida aquí biltigani le clol اللون اللي له سيبا المو ما ضروري تيل التمر أوبيس اللي نقرأ أسئلة questionnaire ما جملة بنغلي له سي أكلو stress أونيرو هذا البلا وهذا نغني يبين أمسوب الواسي binge drinking بتيجي لو مسوبة يوكل غير ديم لاقي مسوبة أمي أو أجي مسوبة ترى أروني الأمانة يا هذا بأجي متيجي لنا ستة بيجال questionnaire سنغني binge eating قدامو أرسل payday قدامو أرسل payday لو أنا وينستيل مو أرسل payday ويجي قدامو أرسل كذا قدام ذيل وسيا eating behavior close الثلاثة اللي هو أمني مرهم رولي لاسيوغان ما بيدي يا أونغيل التقوي أنتما سوري المومداني سانتي سوري رايقال access كتير المور community more information health information الدياغ necessarily tomorrow hospital سل أول building دكتور يانو من أسيم رنيل جرام المسوبة مران مرمي دقيلو أسيم المسئل أخمضي تراني دلان اللي ما يولون أوغر قريل مدنيلو سنغانيا آذن سبقال مسكا قتل information إذا بقتورة مدانا أسبيتال مقلوبة يقال قروب سيجي دام لغوص الكلو لو مسوب يجيو لجيرني اسمال مميلة عندي يسدوا الغني طورا بعد ستمومتو المعني سرا tell disease still fears they have to manage their own disease by looking for that information and access and most given jaha ngala government mada ngala hospital mada ngala private clinic netemlo mimo pal staff by Ongael was saying betul kaya bisot hindi rega kalden self question stress adam o au dudel mora alsang ala klubo eda golo ara dur el Friday bawar or uringin ding it's a cultural affliction suban jaga address ringi mata do ke ringi يا جدا expected هذا ما جدا مل مثله لأن stress أثار most undiagnosed التغير هيلد عشان بلور بيلا زي ما بيتذكر شيء إن جدا الأمسوبة جدا موت المرة جدا الناس إمل لأن سيلبورهم داسورا تيال لونغايل يا هذا جدا الصوريرة المقص موصل المسوارس اللي يعرف لي لا إيريمونو الورالموم أران بقينا مدين السبب behavior average pelawan nanti dia kena mengusung seringi yang angut tanya lah kalau orang ini semua sih dah beli sama. Mungkin kita dia nak telang seringi lagi kalau musura behavior wasing ada orang ini mendira beli dia kena mau sebab LD time ماتيال لولا لا دلون أوك لموضع حسب إيه من قصة كيتيال ليلوم للمول مول غيره ولا لسن بيكسر من ميل. سي أيجي ذا يجي الدوام سي إمبرة ناري يرجي ذا يصير هذا المول لندين ديره هالكذا الأهم وذي ترى هذا النارية هذا بيلا الصوري الدورة. سي كذا أصلا كنت ترى يجي ذا لوم سوبر.
Santy como dice el stress motor de
stressa selnya berraud ra tulula adal sebeda lu asengar tulula adal musubira ngulling aul dasuela movere de la badingel momal aswar ngira badingel bendia di dulu asendingar aul dasuel badingel adiregel mosubel mo subira badingel mo moraheldra Tkedesau ngora maral ma truilbunga made apodingelo asetiang aklor togo dosa tial togo Ongael ndi soal dimel gora aruren sirgid lo asei mbol klor ngud le tial lurungi ara arbe laul melmutre lang am lama tigra sain mangwai gelo go Dr. Kitalong mangwai segid abek Klengar aigal mom arra aigal pharmacy mendira gal di kangari omsu bol marari ndi sel ni ala maklo tu trelo ase tialonga ala amla sois ba la sela gel do ase formal science community matome seringi emla mo kultuk lo ase maral ngari ara lir gi da ladar belo adi gora di so al di moduli lol shere Dr. Kitalong ase sera ra do la 3 years go e popular Ongael ai gal last 3 years selpo ngaga bekaraga mo mora physical check up chega blood chemistry ngak ende gudingelo asen ni ga git tora behavior lolgo actiregal ligegit md sel gume setial blood chemistry ngak endim la mora ayen arinya ayen low ayen chemical sara badingin rarasa ngarinya low ma obes ndim la mo blob sel ndim la mo tatike rogo ndim la mo blob sel diblingel embral merio mangaga diaksal medingel wase ndigo go ngira ke Dr. Kitalong ase ako behavior nga apol oil di osisio guru rabekelsin di imo maklegal bogula di imo biik dia kwatirgel lo mais morger meger mengwadi do ngeli ata tele ketik mungila Santy mungila atela klog ngara mizenti atela klog ngor osha la atela klog ngar obisra UAK atela klog ngor wal blaga tak lagi prut tringa bekelsin blaga tak la ngal gal bekelsin meng ngora wasegi da selor gornya pearl wasa behavior akotel serial sira toktang mar scientist al magurur a behavior meringa dom tabe ringi leng selda obisra toktang goma do ndi sel todo obisra toktang ndi ave kamlora ngamala ngara rigel gora dan beraber ngamla ala blom sisura al sel kamlora kamlora ngara restaurant ngara galla oblomongang leng segidia hotel atial durut ni luar luar Dr. Graz le lo ase gireden ngu tialom sodel Ongael en ngu mor al sela kla adrigid maklangar gid rabekelsin akmodela setiang adlut el masadrier awera bodo dlut lims kemia others 2-3 minutes el gora ngania closing remark kami kum sang aperd
akuna obesity atara selom suba gi biltigeringi trigger okul la telom su adim na tatin mosmer telongan sila mak
oi
kembali ma karir hospital ma doktor monitor tir ma rogo imlani 24 hours access tir mo atokta edim na tatin mosmer mo betertial lomsu lonia babira complication medical complication and it because in telongan I explained to the public Dr. Graz that the study didn't have any contraindications from Ongael or complications from Ongael for all the studies. So people who enrolled in the studies were enrolled for and didn't have the complications. So I gave no mabengay was ngania safety tialilum kadamle validated tialilum iraal marmay.
Jaga side effect ni.
Aside effect ba ngari hindi dimna ka adal mo smer tial
overdose
aro ko to ani aside effect katinge man mor gamala almani aside effect
just when on this matter another piece of information, the doctors in the hospital were happy to learn that there was no problems with the other anti-diabetic drugs interaction.
Take it away. The milima karira, par the milima.
Agrula kasukan mahal.
Agal karira klada tira dimle o sisi dimla ka chance. Tira milima ongael. Ongael may pira other book ngatalo. So nanya may pira karira book ta kabisukan. May pira karira. Hindi dimla ka other masamal mo mosme assistalo. So yeah, say that to thrill other vela rosi. Mga adura Dr. Yano Chris and Al Tostang Chumura Amazon. Bittiagi other bitting in Lusin. At that you will take any Santy. Sell give some information other vela. Rolela behavior ringy. A cell lagat Macleay saying that behavior ringy. A wall a give test ringy as Ongael. A tell Sunday, a rule Sunday. And overnight change.
Setila sink. Sakuma ada mumtabe la blagar de lera selangara klangaringi maklaadringira ay gelangaringi
sel mera istelom suba mlaringa subra alse
paisi
mumdu masaba kalem mumdu mura tela klo ay ga ta dil belom sub te sub mlaringa nutrition ma gero wol classes en tira malai sel lungu e ore changing a drastic change again and start still everyday sugar ringi amle clo ya ada mumula babenge selbura mula babenge mumula mul telu swell ay gigil magigare lo sis akal Dr. Yano asing incentive and benefits at Tkedesau so we go spare ada ka mistera omyangi ay dadi democracy malun tara flugometer ma free medical from the clinic. Knowledge space, a healthy lifestyle, my wellness, I'm the part of the cell rule gauges, a give tested this, a say I want to slow knowledge impart the other bella moving Malmula. Malditmum uda Seba, Yakamal Masau. Say either, at that I'll give a sticker in Ilwa, say either, I'm like tara kisi estelom Sakuma ada mumdu acquire a skill.
Manalage.
E malo spe.
Kada marmara ulobong na gunitra namilterum. I'll give you 2 minutes to say your closing remark, and then Chris.
Well, I can just wish everybody a very good health, and I hope that this piece of research we have been doing will help to go forward in that direction. Oh, we didn't say anything about some animal studies that were performed in Switzerland that help to understand how it works in the details. But I don't know if we have time for that, or maybe another time we discuss that.
Basic is showing that the mice without the behavioral factor showed almost the same effect as the people in our study.
Oh, okay.
So, it was a closed environment, same mice, nothing changing, but there was a slight weight loss, similar to our project, and a lowered sugar level. So, there's the behavioral factor. Maybe we don't know all these things, but those mice were not going to Mamalakal.
I say, mang kertuklo siya, chemically speaking, at ang ngaringiya affector. Tialgara ngaringiya affecting. The remover behavioral, tialgara clinically proven. There is a positive effect.
And the most important thing for me is to tell all the youth and young people in Palau that it's easy to do. To get all the studies, there's everyone to help you. If they need anything, they can come to us and ask. And please don't turn to other medicines, especially those bad medicines.
Oh,
because you can get a natural high from drinking Ongael. I give it to my athletes, so they get energy, and they can move, they can stay awake, they can do all the activities they need. So you don't need to look at things that are not made here.
Yeah. kemal mansulang awara kunsanga chairman bolo similar musum tirgelo reng sa Ongael abtol maklola amdang tretelela adol bodo bringi klimel malmo kluid lel dipendra muklungela lel askumung maklo en sabel di klim askumung magagre en mokluid seguido lo lumel dos perin murura gohi sengara 10 to 12 cups naga murura imlega rabe kilsil sel mo labagel amad lel melongo seringi en mogora mal ngora abi prurga ngora sel bi prurga badengela amo sel gora mal digalait askumga dra sel dil amad allel askum dra allel en mal mokmed lo sel badengela light el iced tea sel momul ringi sel light el badengela iced tea ay ganga amnar mul el mogar malu bitamnas mul ngasain Digir adar bela ay kita tretelel amal sebedlo asing kadamla testringin betogol rak betogol maklol adam armasa milim ringi dimna bolse rambay ulung se tirma ulum le mga taklang artis mang akmal yonitro asa skum ngania garmi Dr. Yano ma Dr. Chris Kitalong ma Seba ma Pearl Atirgang adi momen setir abe time asera blur belau ediregal sebab mi lo mkodong mera obisera UAK tial number 488-0818 masku magi guk mal ngarinya mal meringal ger el kami oges en sabab mamal el sigitrit atat tiragi tiria awal blal mati tradong le waseta plagarang dil musu betial longael por civil mas kami ay gigil ka nger ay gel niya karmiu kami oges kadalo ay sego man sulang kunit ang ngariya aswal mo wala lobong lorgo Seba
mal sokalom teera kamamrokuy Dr. Yano di busutya belenga sulit tilgen rokuy kilngel motkalom su lelam lak tilgagi telada beromsu bedaki mangatya maonga la di hanora magimal belenga sulit tilgen rokuy kilngel mosoy supertial bilkol gol lomsu ikadamla tuwa drama lomsu hindi ako sa elamu tidur ko arke la bopay egitial koram ake chairman diregal el moral me kaya las talongan akar talover belang ye dalom das diregal talaro el moral me se mga protect the environment yung malumol material karangal telam kat maklit the environment si adom ko oras ay go mo o exercise mora team aigal infrastructure any community in the environmental protection has to become the champion and protect the lom and dimu kanya aigal guru sel laham kat maklim dim nganya development urban development without consideration for aigal gidan tigsel the lom ulang erwa question mo toktang giren ingire da lo message tegi da future gido se abela mbulge da hadi tora head and tora still role dan man woman
Please come.
Santy talked about how to make it, and then if you have itchiness in your throat, cook it some more.
Oy. Masih asum komelimra malgo Dr. Kitalong la asum gorawal kamalimrim lo gorangania tribal momgol no mgega umur golem embru asingirem dil mutel smongosin mutel lwa sel kleal del mu segidel lwa momgega dara umur golem ri adalo isigide kwa olgun sanga chairman mamul polo ngasimbra pro musum long simbra
mereka sudah tinggal gestur gitu ya rasis, ekor malam nung saula, dia kalau ham kata lomur ni gaya mereka.
I see.
Dia apa itu? Ulkerreuil Klengar dia ulmun dilu ati gaya gitu, subuh gitu lah, aja tu lah sing dia kalau mau biru rakta. Kamu man move. We are going to do this again. I know there will be a lot of questions coming to the office, so we'll reschedule. And please expect. So thank you very much for all your contribution.
Thank you.
Thank you.
Long.
Bye.